Hispanic mental health challenges and support. Mental health conditions do not discriminate based on color, race, gender, or identity. Anyone can experience challenges of mental illness regardless of their background. However, your concerns or experiences and how you understand and cope with these conditions may be different. So facts about mental health and Latino communities. Common mental health conditions among Latinx are generalized anxiety disorder, major depression, post-traumatic stress disorder, and excessive use of alcohol and drugs. Additionally, suicide is a concern for Latino youth. As estimated, 33% of Latino adults with mental illness receive treatment each year, compared to the U.S. average of 43% without treatment. Certain mental health conditions can worsen and become disabling. So 1 in 3 Latino students say they feel hopeless and sad. Prevalence of mental illness in U.S. Latinx populations. In the U.S. population, 17.8% is estimated to be Latinx or Hispanic. Of that percent, 15% had diagnosable mental illness in the past year. Only 36% of Hispanic people with depression received care. After an initial visit to a psychologist, only 50% of Hispanic people return for a second appointment. So some barriers to mental health care for Latinos. So it says share of percent unmet need among people 18 and older. So unmet needs, we have our non-Hispanic whites here and then our Hispanic Latino. And you can tell by 2019 that they've gotten closer, but still we're lacking. Inequality. While Latinx communities show similar susceptibility to mental illness as the general population, unfortunately, we experience disparities in access to treatment and in the quality of treatment we receive. This inequality puts us at higher risk for more severe and persistent forms of mental health conditions. Stigma. Overall, the Latino community does not talk about mental health issues. There is little information about this topic. We cannot know what nobody has taught us. Many Latinx do not seek treatment because they do not recognize the signs and symptoms of mental health conditions or know where to find help. Others do not seek treatment for fear of being labeled as locos, or crazy, or as having a mental health condition because they may cause shame. Privacy concern. Many of us know el dicho, la ropa sucia se lava en casa. Similarly to, don't air your dirty laundry in public. Many people in the Latino communities tend to be very private and often do not want to talk in public about challenges at home. Seeking mental health treatment doesn't mean you will lose your privacy. Your diagnosis, treatment plan, and discussions with your mental health provider are confidential. They cannot share this information with others without your permission. Furthermore, mental health providers are professionals that understand what you are going through. They will listen without judgment. Next, we have language barriers. Language barriers can make communicating with doctors difficult. Many medical professionals today do speak some medical Spanish, particularly in parts of the country with large Latinx population. But they may not necessarily understand cultural issues. If you are a loved one that needs help, does not speak English, or does not speak it well, you have a right to receive language access services at institutions that receive funding from the federal government. You have the right to request a trained interpreter and to receive forms and information in Spanish. Lack of health insurance. According to the Kaiser Family Foundation, in 2017, 19% of people identifying as Hispanic had no forms of health insurance. The Affordable Care Act is making it easier and more affordable to get insurance. So this is the different percentage of adults without health insurance by race. So we have our white, black, and then Hispanic. And in 2013, that's big because we have the white as only being 15%, but the Hispanic is up to 40%. And then in 2018, I'd say it's down to like 9% for whites and then 25% for Hispanic. So it's getting better. All the numbers have gone down, but it's still, I would like to see it around like the 0 to 5%. But I don't know if that will ever happen in my life. Misdiagnosis. Cultural differences may lead doctors to misdiagnose Latinos. For instance, Latinos may describe the symptom for depression as nervousness, tiredness, or a physical ailment. These symptoms are consistent with depression, but doctors who are not aware of how culture influences mental health may not recognize that these could be signs of depression. So this disorder have among the highest mental health misdiagnosis status is depression and bipolar. Legal status. For immigrants who arrive without documentation, the fear of deportation can prevent them from seeking help. For example, even though millions of children of undocumented immigrants are eligible for health insurance under the Affordable Care Act, many families may be afraid to register. If you do not have legal documentation, seek out clinics and resources that care for all members of the community. Latino-based organizations often provide services regardless of legal status. Natural medicine and home remedies. Some Latinos may prefer traditional healers and home remedies to deal with health-related issues. Mental health may not be an exception. If these healing methods are important to you, do use them. However, we encourage you to seek a mental health professional or a primary care doctor as well. Ask your doctor to make these healing practices part of your treatment plan. Mental health professionals have experience and knowledge of effective types of treatments and what may work for you. You may use both approaches in your road to recovery. Faith and spirituality. Faith and spirituality can provide support and help you deal with a mental health condition. If spirituality is important to you, talk to your doctors about how important faith is to you. Your spiritual practices can be part of your treatment plan. Reach out to your spiritual leaders and faith community. They might be able to provide help and support during the difficult times caused by mental health conditions. At the same time, unfortunately, sometimes faith communities can be a source of additional distress if they are not well informed and do not know how to support families dealing with these conditions.